Hello guys, welcome back to Ophthalmology on the Go. Today we'll be studying the attachments of vitreous. First, understanding what is the vitreous. Vitreous is basically a transparent gel which occupies the posterior compartment of the eye, is 4 ml in volume and constitute 98% as of water. The attachments of vitreous can be summarized in this diagram. Naming them, the first attachment is the vitreous base. The second is along the posterior lens capsule, then along the margins of the macula and along the margins of the optic disc, along the major blood vessels, and then along the periphery at the lattices. First, we'll discuss the vitreous attachment at the vitreous base. The first important thing is the vitreous base attachment is the strongest attachment of the vitreous. Understanding the extent of the vitreous base, here the dot marked in red is basically the ora serrata. So, the vitreous base extends anteriorly 1 to 2 mm to the ora serrata and posteriorly 1 to 3 mm to the ora serrata. That is how much the extent of the vitreous base exists. Now, coming to the second attachment, which is the posterior lens capsule. This attachment of the vitreous along the posterior lens capsule is also known as the hyaloideo-capsular ligament of Weger, right? Hyaloideo-capsular ligament of Weger. Now, this attachment is basically at 2 points along the posterior lens capsule. It basically forms a circle fashion along the posterior lens capsule where it is attached, and this circle forms a diameter of 8 to 9 mm. So basically, if you're looking at it from the front view, this is the lens, and we are looking at this at the posterior lens capsule plane, and this is the front view. So the vitreous attachment at the posterior lens capsule is basically in the circular fashion, and this circle is a diameter of 8 to 9 mm. So this is where the posterior lens capsule shows the attachment of the vitreous. There is a potential space that forms just behind the posterior lens capsule. So this thing drawn in blue, this is the lens. This is the posterior lens capsule. This drawn in orange is the vitreous attachment, the vitreous. Vitreous is attached at this point and this point. So, there is a potential space that is present posterior to the lens capsule. So, this space and between the vitreous, posterior lens capsule and the vitreous. And this space is known as the space of Berger. That was it with the second attachment along the posterior lens capsule. Now, coming to the attachment along the margins of the macula. Along the margins of the macula, there is a circular attachment of the vitreous which forms a circle of 3 to 4 mm diameter. The fourth attachment is along the margins of the optic disc. The attachment along the posterior lens capsule and along the margins of the optic disc usually loosens up with age. So that is when we see a complete PVD or a circle of V's, right? The next attachment is along the major blood vessels. So when we see a PVD induced vitreous hemorrhage, it is basically because the vitreous that was attached to the blood vessels was strongly attached at the blood vessels, and when there is a pull of the vitreous along these blood vessels, it causes the ripping of these blood vessels leading to a vitreous hemorrhage like pathology, right, which is the vitreous hemorrhage. So when we see a PVD induced vitreous hemorrhage, it is important to follow up the patient, make sure that the thorough dilated examination of the fundus is done to look for any breaks that might be present, because with the pulling of the vitreous there can be a retinal break formation as well. So this diagram basically sums up all the vitreous attachments. Thank you.